Let me get my first slide. There we go. So Bruce read you the title of this trial, which is a rather lengthy one. But basically, we took a population of patients who had not received chemotherapy for metastatic lung cancer and who were eligible to receive bevacizumab, gave them 4 cycles of one of several platinum-based combination therapies with bevacizumab, and the subset of patients who had not progressed at that point after 4 cycles were randomized to bevacizumab with erlotinib or bevacizumab with placebo, of course, in a blinded fashion, and a 1-to-1 ratio. The primary endpoint of this study was progression-free survival, and you'll probably hear a lot about at this meeting the merits of different endpoints in lung cancer. Survival is becoming a harder endpoint to show in some of these studies, but the primary endpoint was indeed PFS, and secondary endpoints were ones you commonly see in these studies: overall survival, safety, and some biomarker analyses. This is the Kaplan-Meier curve for progression-free survival with bevacizumab and erlotinib in the lighter color and bevacizumab and placebo in the pinkish color. The median progression-free survival was 4.76 months in the erlotinib arm, 3.75 months in the placebo arm. But it's really more important for doctors and clinicians to look at what, and those in the lay press, to look at what we call the hazard ratio, which really speaks to the totality of the data, not just the data at one point in time. The hazard ratio for this was quite good, 0.722, and the 95% confidence interval is on the right, and the log rank test was 0.0012. Whoops, is that the wrong direction? There we go. So I think another way to get your hands around what does this mean for patients or not is the proportion of patients who are without progression of their cancer at given time points. So if one looks at 3 months in the patient population, about half the patients on placebo are progression-free versus 2/3 on erlotinib. At 6 months, 28% and 40%. I think to treating oncologists in the community, these numbers may have more impact than looking at a 1-month benchmark or just that median time point. The next slide. In conclusion, the addition of erlotinib to bevacizumab after 4 cycles of bevacizumab and chemotherapy significantly improved progression-free survival. We did not see any new safety signals in this study. There have been many studies done of this combination. Dr. Herbst did one of the first, and it's a well-tolerated combination which does not bring with it any novel toxicities. Survival data were not mature at the time of this analysis. We do plan to have them available and published and presented later this year. And biomarker analyses are ongoing, and we think those are really the future to getting all these combinations of targeted therapies to the subgroups who benefit the most. Thank you very much.